Even a very, very small fraction of mortality would mean a large number. So we should go back to that basic prevention of covering your face, uh, maintaining a little distance.
A new health concern is emerging in India, and this time it's a virus unfamiliar to many, Human Metapneumovirus or HMPV. Following two positive cases in infants from Bengaluru, another case has been reported in Gujarat, leaving the nation on high alert. But what is this HMPV and how worried should we be? Dr. Vijay Mishra from East India's famous Medica Hospital group will join us in the conversation today.
Can you please take us through the this new virus HMPV scare?
Hi, Harsh. Thanks for inviting me to this forum to discuss this new scare that is plaguing the country. My name is Dr. Vijay Mishra. I am from Medica Hospital, Ranchi. See, if I have to talk about the current scenario where we are, so if I have to give one liner, there's nothing to worry, right? That's my starting line. Now, this is a virus which has been there for quite some time, 15, 20 years ago. It was first isolated in kids in, I think, in Holland. But it usually would infect all the kids, just like other respiratory viruses, the respiratory syncytial viruses. But now they have found that there has been recent surges in the infection by this human metapneumovirus, which is a virus from the pneumoviridae family, which is basically a virus which is likely to cause respiratory, upper respiratory or lower respiratory tract infection. Okay. So now it has come apart from being in infants and younger children, it's also being seen in people who are immunocompromised and in the elderly people. Usually, it's a self-limiting viral disease, would settle down in most of the cases in 5, 7, 8 days with very basic or respiratory uh, standard supportive care like water and paracetamol and all that. But in rare cases, yes, it can turn into a proper pneumonia or it can worsen people, those who already have asthma or COPD. But as of now, there's nothing to worry about it. All we need to do is to take precautions as we did last time during the infamous COVID.
So, what steps should the government take?
For the government at this point of time, surveillance would be the key, right? Any possible epidemic can be really, I wouldn't say can be controlled, but can be really checked to a large extent by very active surveillance. Right? Now, there's a passive surveillance, there's an active surveillance. Government is in a position to do active surveillance. So I remember during the early days of SARS-CoV-2, that is the COVID-19 pneumonia, government had an active surveillance program where they would ask all the hospitals, including government, private, any kind of healthcare network, to submit the data of patients presenting with influenza-like syndrome, influenza-like illness. So every day, at the end of the day, 5 in the evening, if every healthcare organization actively participates in this active surveillance directed by the government of India, then we can very easily and early start picking up cases which are, kind of, they fall into the possible framework of HMPV.
Yeah, but
And
this
that,
all these things,
sorry.
what I'm saying, all these things are possible in top cities. But what about the villages and rural areas?
See, that's where exactly I was trying to come next. So after active surveillance, what should be the next is easy accessibility of testing for this HMPV, right? So just like it's pretty simple. All they have to do is to get some cartridges and testing kits for HMPV. Uh, the government and even the private care health network has a huge amount of RT-PCR machine testing facility with them, right? So frequent places and frequent testing for um, these this HMPV would be the next step in containment of this disease. So active surveillance, frequent and abundant testing, and obviously Then comes the positive isolation practices, treatment practices, and healthcare network. So if we have local testing facilities, which is not mm, undoable, given the fact that the whole of the country is now flooded with RT-PCR machines, thanks to COVID, right? So they may be sitting idle there, not being used. So the government just have to be more proactive in kind of activating them and supplying them with the kits and testing anybody who comes with an influenza-like illness.
Yeah, and many people are comparing it with common cold or flu. Do you think it is important for all of us to take it seriously? We did the same mistake when COVID came to India first time. So do you think it is there some kind of seriousness is required at this time?
See, a common cold, we don't really have to be worried about it. We do have to give the common cold due respect, right? But talking about any condition which has the potential to turn into an epidemic,
Hmm.
we do have to be on our toes. We cannot take it lightly until the possible epidemic has been contained into an endemic, right? You see, common cold is an endemic disease. It's not an epidemic disease, right? So
Hmm.
in my locality, in my mohalla, in my uh, household, one catches a cold, other catches 10 people, they get cold and they all get sorted. This is endemic. So,
Hmm.
but this HMPV has a potential to become an epidemic, right? So
Hmm.
yes, it does warrant a lot of respect in terms of a possible epidemic disaster, because going by uh, the mortality and the seriousness of the illness, which can happen in infants, elderly, people with immunocompromised status, even a very, very small fraction of mortality would mean a large number. So we do need to be really not worried, but cautious and alert to contain it as early as possible.
Definitely. So, and there was a total ruckus 5 years back when COVID hit India first time, and that resulted in lakhs of death. If we see more cases in the coming days of HNPV, can we expect a rewind of 2020 or something similar to lockdown era?
Uh, Trust me, I don't think lockdown is something that we should be talking at this point of time. Yes, one thing that we must remember from the past, that if we do not contain it early, then it could even if it doesn't is not as fatal as COVID-19, it could still lead to a large number of patients getting hospitalized and having secondary complications. See, the human metapneumovirus per se may not be fatal in a lot of them, but patients getting hospitalized, admitted with immunocompromised status. So yes, we do. We got to be really careful and on our toes in terms of vigilance, active surveillance, frequent testing, and maybe government should be wise and fast enough. And fortunately, we have a similar set of people at the top heading the country, those who were there in the time of COVID. So even they are much wiser now in terms of acting aggressively at an early stage.
And what are the precautions that you are suggesting your patients at this point of time, and you want to suggest the central government and state government that these are the initial steps that if that we can take to counter the disease?
See, my thought process regarding any such um, community health issue, right? When once it becomes epidemic or affects a large number of people, then it will become a community health issue, right? So for any community health issue, the first step is awareness. And the second step is prevention. So we will not be able to enforce or promote prevention unless we increase the awareness. And I think this is the time, then apart from the top leaders of the country just saying, there's nothing to worry, nothing to worry, abhi do hi case aaya hai. Prevention part, is something that we had all learned. We practiced it religiously and rigorously at the time of COVID-19. And now we have all forgotten it very conveniently. So we should go back to that basic prevention of covering your face, maintaining a little distance, cleaning your hands, not touching the infected surfaces. So basically, the transmission is through the respiratory droplets. So my secretions while I'm talking, I'm sneezing, I'm coughing, is likely to go to a distance of up to 2 meters. And anybody coming and touching the same table in less than 30 minutes is likely to kind of pick it up from the table and then they touch their own nose. So covering the face, hand washing, and maintaining that little distance between the crowds is something that we should be doing from day one now. But I would urge the government, the leaders, that this awareness must start now.
Thank you for joining us, and we hope that this disease does not become pandemic in the coming days. Thank you so much.